I'm Fallon. I'm your nurse practitioner student doing your assessment today. I'm going to wash my hands. First, I'm going to start by asking you a few questions. It might seem silly. Where are we at today?
The clinic.
And what is your full name and date of birth?
Molly Stover, 3397.
All right. And what's today's date?
August 4th, 2023.
All right. And then to start through this entire assessment of all body systems, I'm going to be assessing the patient's skin for texture, any redness, swelling, tenderness, any hair distribution, capillary refill, etc. All right, let's get started. First, I'm going to do head and neck. So I'm going to start by first assessing her scalp. I'm going to note any lumps, bumps, redness, deformities, how the hair is distributed, and next I'm going to palpate. I'm going to feel around her scalp, feel for any abnormalities. Also, then I can check and feel the texture of her scalp and how her hair feels. Any tenderness?
Nope.
All right. Perfect. Next, I'm going to assess for TMJ. I'm going to lightly put my hands on the sides of your mouth and have you open and close your jaw, okay? All right. No clicking, any pain?
Nope.
All right. That's great. Now I'm going to have you, we're going to check some facial expressions. So first I'm going to have you squint your eyes, and then I'm going to have you smile, frown, stick your tongue out, and puff your cheeks out. All right. And that is cranial nerve number 7 and number 12. And then I'm going to assess your jaw with a little bit of resistance. So I'm going to put my hands kind of similar, but I'm going to hold your jaw shut and have you try and open, okay? All right, go ahead. Perfect, great job. All right, and next I'm going to move on to I'm going to assess the sensation of the face. I'm going to be using this tool where one side's going to be sharp and one side's going to be dull. Have you tell me if it's sharp or dull, okay?
Okay.
Go ahead and close your eyes.
Dull. Sharp. Dull. Sharp.
All right. And next I'm going to assess your eyes. So first I'm just going to, again, look for symmetry. See if her eyebrows and her eyelids, eyelashes are all symmetrical, and notice any abnormalities, any drainage of the eye. And I'm going to take just my first initial look at her eyeballs, her sclera and her iris. Everything looks great. Next I'm going to palpate her lacrimal ducts. So I'm going to lightly pat and have you close your eyes and I feel above your lids and below. Any tenderness there?
Nope.
All right, great. Now I'm going to have you open your eyes. At this point, I would check visual acuity, which is cranial nerve number 2 and 3. And then we're going to assess pupillary constriction. So I'm going to use my light here. I'm going to shine my light into each eye one at a time, okay? So bright light in your eye, and I'm going to check for pupillary restriction. And we're going to do the next eye. All right. Great job. And next we're going to assess for your ocular eye movement. So I'm going to place my finger in front of you, have you stare at it, and then I'm going to have you keep your head straight and follow with your eyes only, okay? And now I'm going to check for your accommodation. So I'm going to have you in convergence. I'm going to have you follow my finger all the way through to the middle. Perfect. Now I'm going to have you stare at my finger. And now I would like you to stare beyond my finger. All right, great job. And that's using cranial nerve number 3, the ocular motor nerve. All right, next I'm going to take a deeper look into the eye. I would dim the lights at this point. And first I'm going to do one eye at a time. I'm going to check for red reflex, look at the macula, and look for any abnormalities of the eye. Bright light in each eye. And then we're going to do the other eye. All right. Wonderful. Now I'm going to look inside of your nose and have you, first I'm going to check the outside, look for any deviations, any abnormalities. I'm going to have you lift your head straight back. All right. And then I would look at her turbinates for anything abnormal, any deviation. And then I'm going to have you block each nostril. I want you to blow out. We're going to check patency. Perfect. All right. And then next we will assess the mouth. So I'm going to have you open your mouth wide. Thank you. I'm going to look at her tonsils, her uvula, around her soft and hard palate, her tongue, all of her teeth and her gums. I would also take a look at her lips, which can tell us hydration status. Alrighty. And then we're going to move on to the ears. So first we're going to start, I'm just going to take a look at the outside of each ear. Again, for any abnormalities, look at the skin, any earwax coming out, any moles that would be abnormal. And then I'm going to palpate around her ear and behind. Any tenderness when I palpate?
No.
Okay. How about her?
No.
Okay. Now we're going to do the whisper test. So I'm going to stand behind you. I'm going to say whisper 3 letters and 3 numbers. I want you to repeat them, okay?
QDT145.
Great job. Now we'll do the other side.
LHM329.
Great job. Now we're going to do the Rennie and the Weber test. I'm going to use my tuning fork. So to start, I'm going to place this on the top of your head. I want you to tell me if you hear anything, okay?
Yeah.
All right. And next I'm going to place it behind your ear and I want you to tell me when you stop hearing the noise, okay? Can you hear it again?
Yep.
Good. We'll try the other side, okay?
Okay.
How about now?
Yep.
All right. Next, I'm going to take a look inside of your ear. I would inspect the external canal, the internal canal, and tympanic membrane. All right. Do the same with the other side. All right. Now I'm going to assess the lymphatic system. I'm going to feel your lymph nodes around your ears and your neck, okay?
Okay.
So first I'm going to do periauricular and postauricular. I'm going to feel on both sides here. Then occipital, tonsillar, submental and submandibular, posterior cervical, anterior cervical, as well as deep cervical. I'm going to feel supraclavicular and also infraclavicular. All right, any tenderness in any of those spots?
Nope.
All right, great. Now, just since I'm on the lymphatic system, I'm going to also assess the lymph nodes in the armpits. I'm going to have you put your arms straight out. All right, I'm just going to tuck your shirt up here. First, I'm going to palpate for lateral and central. Okay. Subscapular, which is behind. Pectoral in the front. And then epitrochlear on the elbow. Have you bend your elbow? Thank you. All right. I'll do the other side too. And then same here, central and lateral, subscapular, pectoral, and then bend the elbow up, trochlear. Thanks. All right, next we're going to move on to the heart. So first to start, I would just assess all of her extremities for any edema, or swelling and redness. And then next I will just also assess for any heaving or any chest rise and fall abnormalities. And then I'm going to have you come and lay down on the couch here. No, actually, have you lay down and your head up there. I'm going to measure for JVD. Okay. And next I'm going to palpate around the chest area of the heart. Any tenderness?
No.
All right, I'm going to listen to each side of your neck. I'm going to listen for carotid bruit. So I'm going to have you hold your breath and then listen each side. All right, and then you can take a deep breath. All right, and then I'll have you hold your breath again. All right.
You can crowd that, can you?
Yeah, I think
Okay.
so. Right?
Yeah, you can.
Okay, should be good. Okay, and then next I'm going to assess your pulses. So first I'm going to start each carotid one at a time. All right, and then brachial, radial, femoral, okay, and I'm going to feel for popliteal behind the knee. And then behind the other knee here, feel relax. Straight. Okay. And then I'm going to slide your socks off. Behind each heel, posterior tib. And then on top of the foot, the dorsalis pedis. All right, I'm also going to feel down your legs. I want you to let me know if you have any tenderness, okay?
Okay. Nope.
Nope. Great. All right, now I'm going to listen to your heart. Actually, first I'm going to palpate for your point of maximal impulse, which is the fifth intercostal space subclavicular. So I will feel. All right. Now I'm going to listen. I'm actually going to have you sit up on the side of the bed for this, just so I can see a little better. Thank you. Okay. All right. Now I'm going to have you lay back down on your side here. And I listen for any mitral regurgitation. You can just be normal. And now we're going to sit back up. I'm going to listen for any aortic regurgitation. I'm going to have you lean forward. And then on your exhale, I want you to hold your breath, okay? Go ahead. All right. Next, I'm going to assess your lungs. I'll have you sit kind of sideways just so your back is facing the camera here. Other way. Perfect. All right. So first, I'm just going to inspect, check for respiratory effort for symmetry. Then I'm going to place my hands. I'm going to palpate for tactile fremitus and for symmetry. Take a deep breath. All right. Then I'm going to feel over her scapula. And down her spine. Any tenderness there?
No.
All right, now I'm going to percuss over her lungs. Okay. And next I'm going to listen. So I'll have you take a couple deep breaths. All right. Now I'm going to have you turn around and face the other way. I'm going to assess the front, your anterior lungs. So same thing, I'm going to palpate. Any pain there?
No.
And I'm going to feel for symmetry again, so another deep breath. No tactile fremitus noted. If there was any crackles or wheezing, that would cause me to then do additional assessments. I'm going to percuss again over your lung fields. And then I'm going to do a listen. And next we're gonna check, we're gonna assess your abdomen. So I'm gonna have you again lay down on the bed, chair, table, couch, whatever. Okay. And so to start, I'm gonna have you just lift your shirt right, yep, above there, perfect. I'm gonna assess for any hernias, any abnormal masses, any skin problems. And first I'm going to listen, starting in the right lower quadrant. And then I'm going to assess the aortic arteries, iliac, renal, and also inguinal for any bruise. Alright. And next I'm going to percuss. So first I'm going to percuss over the liver so that I can measure. Men's livers tend to be a little bit larger than women's. So I'm going to percuss over the liver so I can find the border. And then I'll do the same thing on the side for the spleen. Okay. I'm just going to feel over the aorta. Alright, and now I'm going to percuss the abdomen. Okay, then I'm going to palpate for the liver. I'm going to feel on your side here, and then I'm going to do a little bit of a scoop. And then next I'm going to also palpate for the spleen. And I'm also going to attempt to palpate the kidneys. I'm going to take a deep breath. Okay, same on the other side, big deep breath. Okay, now I'm going to lightly palpate first the abdomen. Any tenderness?
Nope.
I'm going to deep palpate. Any pain?
No.
I'm feeling for any masses. Alright, now I'm going to do a couple maneuvers on you just to test for a few things, okay? First I'm going to start by pressing lightly on your abdomen and withdrawing, okay?
Mm-hmm.
Okay, and then I'm going to press only on your left side here. Any pain?
No pain.
Wonderful. Next I'm going to have you flex your knees straight up. Any pain?
Nope.
Okay. And then I'm also going to feel for, those are to check for appendicitis, and I'm also going to assess for acute cholecystitis. So I'm going to have you take a really deep breath. I'm going to feel over your gallbladder, okay? Any pain there? Great. Now I'm going to have you turn on your side because I'm going to assess for appendicitis again, okay? Leave us. So I'm going to have you straighten your leg, and I'm just going to have you just push it straight back. Any pain?
Nope.
All right. Perfect. You can go ahead and move back onto your back. All right, now we're going to assess the musculoskeletal system. So first to start, I'm going to have you sit on the edge of the bed. I'm going to feel on your joints here just so I can get a good sense for any fremitus, crepitus, any pain or any issues with the joint, swelling, inflammation, etc. First we're going to start with shoulders, so I'm just going to have you rotate your shoulder. And then your elbow will go. Any pain?
Mm-mm.
Same with your wrist. Okay, we'll do the same thing on the other side. Rotate your shoulder. All right. Elbow. Wrist. Are you able to go like this with your fingers? Great. Next we're going to do knee, so I'm just going to hold the back of your knee. I want you to straighten it out. All right, and then go ahead and bend it back down. Same with the other side. All right. Then I'm going to pick your foot up and I'll have you rotate your ankle. All right, and same with the other side here. Okay, all right. All right, and next I'm gonna do a total of 2 joint systems. So I'm gonna assess your shoulders and I'm gonna assess your knees. So to start with your shoulders, I'm gonna have you bring each arm straight out to the side and then straight up. Great, and then you put it back down on your side. And then I'm gonna have you bring your arms straight forward and then straight back. Flexion, extension. Great, then I'm gonna have you cross one at a time, each arm across your chest. Rotation, and then I'm going to have you put your arms straight up like this, like goalpost, and then I'm going to have you flex them down. All right, and then we're assessing the rotation there. Any pain at all with that? Great. Next, I'm going to have you do the same thing with your knee. I'm going to have you flex your knee straight out and straight down. Okay, and then we'll do the same thing here. Straight out, straight down. Okay, now I'm going to have you lay on your back. We're going to do a couple more joint assessments. So first I'm going to palpate those hips. So I'm going to have you just swing your legs, bend your legs straight up. Okay, down. Same thing on the other side. Great. All right, and now I'm going to do a mini rigid check on your meniscus. Okay, so I'm going to bend your leg up. I'm going to rotate your foot and I'm going to push on your knee. Any pain?
No.
Okay. Great. And then next I'm going to have you sit up again. Okay. Perfect, and I'm going to assess the tibial drawer here. So I'm going to push on your tibia and I'm going to see if it slides in like a drawer, either posterior or anterior. All right, any pain? Great. All right, next we're going to move on to the neurological system. Okay, so overall I would assess your gait when you came in and her neurological status throughout the entire assessment, her mental status. And then we're going to first start with sensation. So I'm going to use the same tool that I used earlier, and I'm going to have you close your eyes and tell me I'm doing on parts of your body. I want you to tell me if you feel them, okay?
Yep.
Now I'm going to do your lower legs. And also on your feet.
Yep.
All right, great. All right, next we're gonna do just a couple of sensory activities. So I'm gonna have you start with both your arms pointing straight out. I'm gonna have you touch your finger to your nose. And the other one as well. All right, and then I'm gonna put my finger straight out and I want you to touch from your nose to my finger. So finger to your nose, then to my finger. All right, and then the other side. All right, great. Then next I'm gonna have you stretch your fingers out. And I want you to touch your thumb to each finger individually. Great, and can you flip your palms upside? Perfect. All right, great job. Next I'm gonna have you run your heel down the front of your tibia. Perfect, front of your calf. Awesome. And now, can you tap your toes on your tips-toes and feet one at a time? All right, very good. Now I'm gonna check your reflexes, okay? I'm gonna use my hammer. So I'm gonna dangle your arm out here, have you just totally relax. All right, and then I'll do the others. Totally relax. All right. That's here. Okay, next arm. Okay. And then next I'm gonna have you scooch all the way back here. All right, you can scoot back even a little bit more just so your feet are dangling. Okay, now we're gonna assess your knees. Let's carry on the stairs. Okay. All right. Really up the tempo, perfect. Okay. Alrighty, and then I'm going to also I'm gonna have you stick your foot straight up for me. Alright. And then also, I'm gonna check for Babinski. Perfect. Then I'm also gonna have you close your eyes and I want you to tell me which way I'm flexing your big toe, up or down, okay?
Up.
Okay. Up. Up. Next foot. Up, down, up, up. Okay. Now I'm gonna have you you keep your eyes closed. And I'm going to put an object in your hand and I want you to tell me what it is, okay? Paper? Perfect. All right. And next I'm going to have you stand up. We're going to do a couple more tests. You can open your eyes. Okay. First, to start, I'm going to have you just stand straight forward with your eyes open, feet together. Okay? And just try and hold still for me. Now with your eyes closed. All right, I'll have you take a little step back with your eyes open. Then I'll have you put both your arms out, straight, and then close your eyes again. All right, great job. You can open your eyes. Next, I'm going to have you walk heel, toe, straight across the room. All right, and then can you walk heel to toe, heel to toe, heel to toe? And then walk on your tippy toes. Very good. Okay, then I'm going to have you stand on one foot. And then how about with your eyes closed? Great. Now open your eyes. You can hop on one foot. Good job. Now I'm going to have you squat down to a squat position. And then I want you just to put all of your weight on your toes like this. Very good. All right. Great job. Thank you.
Thank you. That was it?